Welcome to Sensible Health Solutions, the show where we simplify health and wellness. Join your hosts, Hallie Fields and Dr. Scott Luper, as they share practical tips and expert insight to help you navigate common ailments, nutrition, and overall well-being. Tune in for straightforward advice that empowers you to live a healthier life.
Hello, Haley.
Hi, Dr. Luper.
How you doing?
Good. I am very interested in continuing our discussion on fatigue. It's something that affects a lot of people. And so going more into detail with different elements that impact fatigue, I wanted to cover anemia, because I think that's something that patients struggle a lot with.
They do, in fact. It's a common problem. So, there's lots of things that will cause people to be tired. One of those things is for people to be anemic.
And just for general information for maybe people listening who don't know what anemia is, can you describe it?
Sure. Anemia is when your body has some breakdown that prevents it from carrying enough oxygen to meet your body's needs. Typically what happens is either your red blood cell count goes low, or your hemoglobin, which is the molecule that's inside the red blood cells, goes low. And sometimes both of them happen. And either one of those will cause anemia.
Wonderful.
I could say a lot more.
We will say a lot more. We'll continue. So how can you tell if that is something that patients are struggling with?
Well, that's a good question. You can kind of tell by looking at them. They tend to be pale. They tend to have dry skin. They tend to be kind of dull and lacking luster. They just tend to look real tired, is what they tend to look like. Now, I've just covered lots of different kinds of reasons somebody would be tired. That's also the look that, more or less, that people with low thyroid have, and so on and so forth. So the correct answer to your question is you got to check their blood. It's a blood test that'll let you know. Once you do the blood test, you can see for sure whether they have anemia or not.
And is that like a standard blood test that you typically run for patients who come to you with fatigue concerns?
Pretty much every patient ever comes that I see, I get it's called a CBC. That stands for a complete blood count. And a CBC will look at the number of white blood cells and red blood cells, and then they'll look at the size and shape of those red blood cells as well, and also just measure the hemoglobin that's in your blood as a whole. And then those information, all that stuff together will let you know whether you have anemia or not. And also it'll give you a pretty good sense of what kind of anemia you have. Sometimes you have to run specialty tests to follow up to figure out exactly what specific kind of anemia you have. But the big guys are pretty much covered in the way that the blood test results come back.
So that gives me another question, but I'm going to ask my first question. Why does anemia make you tired?
That's another good question. It's real straightforward. Anemia is when your body can't carry enough oxygen. And so you don't have enough oxygen. Your body runs on oxygen. It burns oxygen to get energy. Basically burns fuel to generate ATP, makes energy so you can do stuff. Without that oxygen, or the oxygen in short supply, you don't run as well. Everything just kind of goes low and slow, and so you just can't do as much. You know, you may be fine and normal as long as you don't get up and do anything, but if you're at an airport and you have to run to catch another flight, you find yourself, panting, exhausted, and you just can't do it.
Gas.
You just literally can't go. You have to stop and miss the flight because you can't run that quarter mile from one gate to the other.
So my next question would be, you talked about different types of anemia. Are there more than one type? Is there more than one type?
Absolutely.
Okay.
So the most common, usually when you talk about anemia, everybody thinks iron deficiency anemia.
Right.
And it's the most common. I mean, it's absolutely a valid, common type of anemia. But it is absolutely not the only kind of anemia there is. There's other kinds of anemia where you don't make enough red blood cells. The problem isn't iron. There's plenty of iron. But there's not enough stuff to literally make the cells. It takes energy and it takes particular nutrients to be able to make those cells. Let me back it up a bit and say, cells, what cells? These are the cells, red blood cells, that are being made mostly in your bone marrow. Some of them are being made in your liver, but mostly in your bone marrow. And so what happens is you have a cell and it divides out and makes a smaller cell and another one and another one and another one and another one. So you have these stem cells, these kind of mother cells, if you will, that keep dividing out the children's cells. And they have to go through a maturation process. And then when they're mature, boop, they get out in the bloodstream and off they go, doing what they're going to do. Now that process of making new cells, it takes energy, lots of it, and it also takes certain nutrients to be able to make the DNA. In order to divide cells, you have to divide the DNA. You have to make a whole new set of DNA. That set lines up and divides. Half goes here, half goes there. Now you pinch off and you have a new cell. Now for red blood cells in humans, we reabsorb all the DNA and recycle it. And so the mature red blood cells, one of the marks of that maturity is they don't have a nucleus. They're just basically bags full of mostly hemoglobin. Anyway, so they don't have the nucleus in there, but they needed one to get started. So I'll give you an example where a breakdown could be. It could be that you don't have enough B12 to make those cells. B12 is necessary for the replication of DNA. Without B12, you can't make enough DNA. Folate, same story. B12 is more commonly deficient than folate, but folate could be a problem as well. They're both required for the manufacture of DNA. Now, if you can't make enough DNA, then the body's not stupid. It tries to use what it can and make what it can the best it can to solve the problem. The problem in this case being you don't have enough red blood cells. You're in short supply. But you could just make them bigger, and they'll carry more hemoglobin. And that's what the body does. It just makes the red blood cells that it can bigger. And so you get these bigger red blood cells. They're called macrocytosis. Shows up in the blood test. It's one of the things the blood test measures. So if somebody has a B12 deficiency, you can get a pretty good guess if they have a B12 deficiency based on the size of their red blood cells. The fact that there are too few of them and the ones that are there are too big. There is a limit to this because somehow or other you got to stuff these oversized red blood cells in the same small tubes.
Right.
The capillaries.
The capillaries, yeah.
So they can fold and kind of bend a little and cram them in there, and the body will. But at a certain point, you just can't make them any bigger. It just won't work.
Does that put patients at risk for clotting?
Not really. It puts them at risk for having poor blood circulation.
Right.
So clotting is when the blood cells all glom together and make a blood clot. We're not talking about that. We're talking about individual cells just trying to slide through the tubes to go by the cells and do their job, to release oxygen into the tissues. It just doesn't work quite as well when the cells are too big. So anyways, there's that. So there's a kind of anemia that's pretty easy to find, pretty easy to treat. What you do is you give people a B12 shot. You can actually just have them take B12 orally. I know you didn't ask how to treat it.
Not yet. I was going to get to all of that in a bit, but...
You gave me that look. So how you treat it is you have people take B12. Now the tricky thing about B12 is, in order for B12 to be absorbed, you could eat 50 of these little pills, and if you don't have a certain chemical in your stomach called intrinsic factor, you won't absorb it. It'll just flow right on through and go right into the toilet. You won't absorb anything.
Then how do you produce more intrinsic factor?
Your stomach has to be healthy.
Okay.
It's a normal thing that normal stomachs make. If your stomach is sick, and there's a number of different stomach problems that you can have that will, atrophic gastritis, for example, is one of those. What it'll do is it'll inhibit the production, or block the production of that intrinsic factor. Those people will absolutely get an anemia with red blood cells that are too big. Again, I said the name for that is macrocytic anemia. They get macrocytic anemia. And then the solution for that is you give them a B12 shot. Easy, simple, cheap. It's an easy thing to do. The other thing you can do is, if you want to improve the B12 absorption, is you get those little tablets. You don't take it as a pill. What you do is you put it as a tablet in your mouth, and you suck on it, and it dissolves in your mouth, and some of the B12 gets absorbed by your mucous membranes in your mouth. I don't know if you knew that, but your mouth can actually absorb stuff.
Right.
B12 is one of those things you can absorb. It's not great. It's not going to absorb all the B12, but if you got a kind of a borderline problem, it'll take care of it, and you won't actually have a problem. You don't need the shot. You just take B12 by mouth.
Okay. So you talked about the energy that the body makes to produce all of these different types of red blood cells, white blood cells, hemoglobin. What happens when your body is using so much energy to fight off infection when you're sick?
Then you can get anemia. Now, if you're just sick for a weekend, you get a cold and you get you get a flu or fever or something like that, whatever, you get something like that, It's just too short. It doesn't really show up. You might not be making that many red blood cells during the time that you're actually sick, but you're only sick for 3 days, so who cares? Because it really doesn't show up in any blood cells.
But more so for patients who have chronic illness.
We certainly see a lot of those around here, don't we?
Yeah.
And so this is a common problem. We see a lot of it. In the general population, it's not so common, but in our population, people come here to the clinic, we see it routinely, people coming up with this. And so the thing to do is, the next question, you give me the look, is what do you do about it? The answer is, you have to get them healthy.
Yeah.
Somehow or other. You have to figure out a way to build people up. You have to build their digestive system up. I have to be careful because that's a whole nother show in and of itself right there. How do you treat that? Let me just keep it super simple. You build up their digestive system so they can absorb the nutrients that they eat. That puts them in general circulation. Now the body can do something with those nutrients. You can get them to come in. That's a lovely answer, but can we give a better answer? The answer is yes. What I do with those people is everything I said, except for I'll put them on a product that we carry here in the clinic. It's a Chinese medicine formula put together by Health Concerns. It's the company. And again, we're not selling this stuff, so I'm not making any money on this. I'm just literally telling you guys.
You don't have to
works.
gatekeep. You can recommend
all
you can.
And what it is called Marrow Plus. And it's really designed through the Chinese, the logic of Chinese medicine, how to stimulate bone marrow to do its job better. And by golly, it works. It's dependable. I use it routinely, and it builds people's blood cells up, the red blood cells go up, and the anemia goes down, and either people just go right out of anemia or the anemia is improved. That's the least we get out of this is the anemia is improved. So Marrow Plus by Health Concerns is particularly helpful.
Is it possible for patients to have normal iron levels in their blood and still suffer from anemia?
Yes, and in fact, it's common. Isn't that weird?
Yeah.
You think if you have an iron deficient anemia, the test to show your iron deficiency would be you do a blood test and shows you're deficient in your blood.
Right.
No, au contraire. No, normally the test will show that the iron in the blood is normal. But the problem is the blood test is not really checking where the iron needs to be to make blood out of it, because there's lots of different areas where iron can be, compartments, if you will.
Sure. So does that mean it's getting stuck somewhere?
Well, you get some in your blood that's floating around, moving around, right? You can have some that's bound up with proteins and put into long-term storage. You can have some that's bound up with proteins and put into short-term storage. That is the pool that the body uses to make blood out of, to make hemoglobin out of, okay? And that is measured by a test called ferritin. And the ferritin is a protein that holds a piece of iron that keeps it safe, because otherwise iron just wreaks havoc. Iron is a strong oxidative chemical. It's analogous to starting up a chainsaw, getting it running, and throwing it in your bloodstream, and just having it wreck things.
Okay.
That is uncontrolled iron. It's just microscopically, mind you, right? These are tiny little chainsaws, very small, but they're ripping stuff all over. So if you got to put them in a cage, that's what ferritin is. It's a cage that holds the iron and keeps it safe so we can move it all around the body. And that iron in the cage is the stuff that your body uses to make hemoglobin out of. And so if you want to get a sense of whether somebody's low of iron, check their ferritin. Ferritin will give you the right answer.
So if the ferritin levels are normal,
chances are you don't have iron deficiency.
Okay.
Now, there's trickiness here because there's a subtlety. There's what you read in the book, and this is a straightforward case, and then there's real life that's in between.
Sure.
And so sometimes I'll have somebody who's got a chronic illness, and they don't absorb iron very well. It's part of their illness, and they don't have a lot of energy to make red blood cells. And now what do they have? Do they have iron deficiency, or do they have anemia of chronic illness? Well, they have both, and they're all kind of interleaved with each other. So let me get to the iron part of this with the treatment of this one, because everybody already knows what the treatment is. You take iron, right?
Okay.
Except for it's not as easy as you think, taking iron. Because the normal form that you would take iron in is constipating.
Right.
It makes you where you can hardly poop. It's called iron sulfate. It's the normal, regular, doctor stuff that you get, and it doesn't really work that well. So here's a tip. If you do have iron deficient anemia, what you need to do is you need to take a chelated iron, where you take the iron atom and you attach it to this other molecule, and then the other molecule gives a handle for your body to pull it in. Iron picolinate, for example, the picolinate is attached to the iron, and so you can get the iron in better. The iron sulfate is not really chelated, it's combined chemically, but it doesn't really hold that well, and the absorption's bad, it causes constipation, it doesn't really work that well. So iron sulfate just, doesn't work. Better is get another kind of iron chelate, and then you'll be able to pull the iron in better. The other thing that's super important to keep in mind is that in order to absorb iron, you need to run it through an acid bath. When you run iron through an acid bath, it makes it sticky. It's easier to get a hold of, it's easier to cage, it's easier to move around, it's just easier to use, it's easier to process and use. So, acid bath. What? Acid bath?
What
Your
kind
stomach.
of, yeah, okay, so what kind of acid do you need to incorporate into your stomach to make that sticky
The good news,
environment?
your stomach makes acid already on its own without you having to do anything.
Okay.
It's hydrochloric acid. Your body just makes hydrochloric acid as just a way to digest your food. It's one of the elements of digestion. And
If your stomach doesn't produce enough of that, is that a supplement that you can
there
take?
you go. If your stomach doesn't produce enough hydrochloric acid, then your absorption of iron is going to be poor no matter what. You can take iron till the cows come home, and it's just not really going to do much because you can't really absorb it. And so those people really suffer because let's say they'll come in and I'll say, oh, look, you're anemic. Yeah, I know. I've been anemic my whole life.
Mm-hmm.
Well, this looks like an iron deficient anemia. Yeah, I was given iron. It never helped. And again, we had this conversation a dozen times.
Yeah.
And at this point in my career, I go, oh boy, because I know how to fix it.
Yeah.
And what I end up doing is putting people on very mild acid capsules. They're called betaine hydrochloride. It's got a teeny little bit of acid in it, but enough.
Yeah.
And I put them on the betaine hydrochloride while they take iron, and they absorb it fine. And it just cures their anemia. Knock on wood, every time we do it, it works.
Is it possible for somebody to take too much iron?
Oh, yeah, absolutely. Remember I was telling you, the iron's like little chainsaws,
right? Yeah.
And you can absolutely take too much iron, and it is damaging. There's people who naturally absorb iron better than others. It's a genetic, I was going to call it a mutation. It has a downside, so I think maybe that's an okay word. It's also, you can think of it as a superpower.
Yeah, genetic gift, perhaps.
To absorb iron is really good. And those people have hemochromatosis, and they'll absorb iron so much and they'll pack it away, they'll store it in their body. And even though it's in safe long-term storage, it still is damaging eventually. And what those people will do in long term is they'll have liver failure.
Oh.
They have basically a breakdown of their body tissues. They also have bronze. Your body will stick iron wherever it can. One of the safer places you can put it is into your skin. And so you tan kind of this rusty color. Yeah. Most folks are pretty highly motivated not to let that happen.
Right.
And so what we
That's
need
interesting because in the inverse, when you don't have enough iron, you tend to be pale.
Yeah.
Yeah.
And so what we do is we have to block iron. We have to make sure they don't take iron, number
Okay,
one.
yeah.
And also the iron that they get is not absorbed. And so there's things we can do to have that be bound up. There's herbs that are particularly good. They have tannins in them that'll bind the iron up.
Okay.
And then the iron can't get picked up. Oak, we carry it. Quercus is an herb that'll do this. Tea, honestly, just regular black tea will do it as well. And a bunch of different kind of herbs that are helpful with this.
Would wine help? You just say tannins,
Yeah, I don't
and it
know
makes
about
me
the wine.
think
Well,
about
maybe
wine.
theoretically.
Yeah.
There's some downsides to chugging half-gallon wine every day.
Yeah, that's probably more than there's benefits, but...
Yeah, I know. It's a mixed bag with the wine thing.
So, can we go back to how B12 affects anemia?
Yeah, let's go describe where the breakdown is. B12 is necessary to make DNA.
Mm-hmm.
Making DNA is necessary to making red blood cells because those are cells that have DNA in them. At least they did at one point. And so without enough B12, you can't make enough red blood cells. You're going to be anemic.
Yeah.
So if you can get B12 into your system, then you don't have a problem with that. Folate is the same story. It's not as commonly deficient as B12, but it does the same thing. And so it's very important. Just kind of think of them together. Let me translate it another way. When we treat people for anemia, and we can see that they have a deficiency, one of the things we put them on is a formula that we have here. It's called Ferrozorb. Thorne makes it, and it's got B12 and folate in it already.
Combined
in with this chelated iron, and it covers bases.
Oh, so that sounds like a miracle
nicely. It's
supplement.
an easy thing to do.
Okay.
Yeah, it's a simple, and people routinely just get fixed by taking it.
So is there ever an endpoint to patients' anemia, or is there ever a point to which they have
wouldn't
enough?
even get treated anymore? Yeah, it's possible. Let's talk about ways. First of all, I hate pills, so let's talk with the no-pill version of treating iron deficient anemia.
Okay.
Yeah, it's pretty straightforward. What you do is you get a cast iron pan and a metal spatula. Don't use a nylon spatula.
So you scrape particles of metal off and you
exactly
ingest
what you're
it.
doing. Now you're not.
Does that give you toxic metal poisoning at any point?
What you can do is you're not. You first of all, you ever tried to scrape a pan? You can't really scrape anything off it. Not much gets scraped.
Yeah.
It's not like you're scraping out spoonfuls of iron. That doesn't happen. These are microscopic, little teeny particles you can hardly see that are mixed with your food, and that tends to make them more absorbable. So the thing is, nylon just won't knock the iron molecules off of the pan, so it doesn't really help very much. Whereas a metal spatula, stainless steel, scrape. I mean, the spatula doesn't look any different, the pan doesn't look any different, but in fact, microscopic little pieces are scraping off that pan, getting into your food, and you can get your iron from a metal pan. Now, in the cases, this is a two-edged sword. People are deficient on iron, woohoo, excellent, well done. People got too much iron, oh, I'm so sorry. You've worked for years to get that pan just right. Now you need a pitch.
Seasoned cast iron for years.
I've had to have patients cry and shed a tear as they pitch their pans that they can no longer use because they got too much iron in their diet already. Their ability.
So how do you take the iron out of their system if they have too much?
So that's another good question. With women, it's easy. They do it every month. They do it with their menses. What you do, you have to bleed them.
Right.
So if you're losing blood on your own, you're losing iron.
Okay.
This is one of the reasons why women are much more likely to be iron deficient than men are. Now with men, there's another way to do this. Is what you do is you go take blood out. You go give blood away.
Give blood, sure.
And then you can get the blood out that way. The other thing is to get rid of the iron is just let time pass. It'll go on its own because iron gets incorporated into your skin. It gets incorporated into little bit of cells that kind of fall off. And you're able to get in your hair, and it's able to kind of slowly get the iron out of your system. And as long as the iron's not causing any problem, I'm thinking of real life. I'm thinking of the patients that have actually come to me who had their iron levels too high, and their liver enzymes are too high, and their ferritin levels are too high. I ran the test. It's a blood test, a genetic blood test. Found out they had hemochromatosis. They had the genes for this, but they weren't necessarily falling apart. They didn't come late in the process. They came early in the process. We found the problems, what we did. Those people, I don't worry about it at all. We don't have to take blood from them at all. We set up the system where we bind iron up, and it just naturally comes down of its own accord. And I'll check them every 3 months or 6 months, depending on how far along in the process we are. And they do hunky-dory. Again, it's just routine. It's like it's a snap. And once we figured out what to do and kind of how to manage it, it's funny. I think everybody should just do exactly what we're doing. I don't know why they don't. They should. We tell them we're trying to do it right now.
Yeah. Well, you mentioned cooking with cast iron, cooking with metal. What foods specifically can people take more of, eat more of?
Like if they want iron?
Yeah, if they want iron, if they want B12, if they want folate.
So that's a good question. Things. I'm not going to answer that. I'm going to ask you. Okay, think about it. Iron. What's it in? Blood.
Right, so you want to eat meat.
There you go.
Red meat.
Oh, that's it.
Folate, I, have gone through pregnancy and I've gone through the recommendations. I know spinach is high in folate.
Spinach is high in iron.
And iron.
So not super high.
Not like red meat.
Red meat. Meats in general, red meat in particular. Blood.
Right.
Huh?
On the rare side.
Doesn't have to be. You can cook it. You can cook it to within an inch of its life, and it still has the iron in it.
Blasphemy. I want it mooing on the plate.
Well, there's that. That's another issue. The iron is still there. You didn't cook it away where it's not there anymore. Oh, it's still there.
Oh, okay. Okay.
Your charcoal briquette is high in iron.
What about what about B12 foods?
Like B12 foods.
Yeah.
Yeah, there aren't any. Well, okay, you want to squeeze your eyes and turn your head sideways. Mushrooms have B12 in it.
Okay.
And red meat. But no vegetarian sources. Red
Okay.
meat. It's made by people, and it comes in that way. Let me say it that way.
Okay.
I mean, made by animals. What are we saying? Made by animals.
I've also heard that vitamin C is super important in the conversion of iron.
Okay, we're back to the same acid story.
Okay.
Vitamin C, otherwise known as ascorbic acid.
Oh.
Now you know the reason.
Oh, there
so
it
if you
is.
take vitamin C, your chances of getting iron in your body goes up because the acid activates the iron to be able to absorb it. What it's doing is it's stripping an electron from it and causing it to get sticky, and so you can grab a hold and pull it in.
Okay.
So it's not really that great. Vitamin C is like, meh. I haven't been able to cure someone with vitamin C doing this, and I've tried. It just doesn't really work that well. So in theory, it works really well, but I'm sorry. In fact,
In actuality.
it doesn't really make that much of a difference. And either way, I have a patient right now who I'm treating for too much iron. He's got hemochromatosis. He sent me a message saying, I read about vitamin C and how it's helpful for hemochromatosis. You're having me not take it. And I said, you're right. Iron is a pro-oxidant, and vitamin C is an antioxidant. It tends to quench the iron so it doesn't cause trouble when it's in your body. But as antioxidants go, vitamin C is weak. There's way better stuff you can take that gives you way more protection. And the vitamin C also enhances the absorption of your iron. So no, you can't have vitamin C. And again, I have no religion about this. I just know from
What works.
What works,
Yeah,
yeah,
what
just
you've
do
done
stuff
in
that
your
works, yeah.
practice and seen in your patients.
Okay, so let me just mention a couple other things which are super minor, and almost nobody has this except for unless you have it, it's major.
Yeah.
And that's hemoglobin mutations, DNA gene problems, where you don't make the correct form of hemoglobin. And that is sickle cell anemia and thalassemia. Both of these conditions were kind of bred into the human populations because people will have one allele for this problem, have a resistance to malaria. People have two alleles, have severe anemia because the hemoglobin doesn't take the right configuration. It tends to warp, and it causes the red blood cells to warp, or the red blood cells warping causes hemoglobin warp. Whatever it is, there's this warping that goes on. So a red blood cell should be shaped like a donut, except for instead of having a hole in the middle, it just has a dip. The membrane goes around, dips in, goes around, dips in, and has this shape that allows it to bend and twist and go through all the capillaries. People who have sickle cell allele, the sickle cell gene, when you poke on the cells and you jiggle them a little bit, they sickle. They turn into this, moon shape.
Oh.
And that makes them jam. And so they jam. That's fabulous if they're affected with the malaria organisms, because they've jammed into the liver or they jam into the spleen, and the cells that break down those cells can get easy access to them, bust them up, and then you can survive malaria because you're cleaning it out of your system as fast as it's getting laid down. So it's an absolute advantage. You got two of these, and you blow on people funny, whatever, and they go sickle, 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 sickle. Your body absorbs all that, breaks it all down, and now you have severe anemia. And also the breakdown of the red blood cells all at once is toxic. It makes you feel horrible. Anyway, so there's these things going on. The treatment is, there really is no treatment. It's a genetic problem. What they end up
And they
doing,
suffer lifelong with it?
lifelong, because you have it forever. What they end up doing is doing blood transfusions mostly.
Oh, okay.
And the other thing that you can do is do things that stabilize the red blood cells, make them less likely to sickle. Antioxidants tend to be helpful. Clean eating tends to be helpful. Fast food and deep fried foods and those kinds of things tend to be worse.
That they don't really help much,
even with that, you still have this problem.
Right.
And it'll sickle or for reasons we don't even understand.
Even with blood transfusions, does it come back after?
Yeah, with blood transfusions, what happens is you keep making new blood. Old blood that you got from somebody else gets used up, and
then
now you
your
make
body
new blood,
is
and now you're back to
producing-
your same old blood. The true blood transfusion won't last very long. Also, these people have a real hard time with iron overload because they're getting blood from other people. Remember, I told you if you take blood and guzzle it, you're going to get an iron overload, right? 'Cause
Yeah.
you're drinking blood sausage, right? In this case, you're not guzzling it; you're just going straight in your veins, but it's still getting into your body. You're getting some iron, blood from other people, and you're getting iron from other people. It makes it hard to deal with. Your body has a hard time having to get rid of all that iron. So I don't see that much in my practice to be able to see it. In fact, I've never treated sickle cell anemia in 30 years. But I've treated thalassemia a fair number of times.
Okay.
And the population that comes here in this clinic, thalassemia it's rare, but it's not completely rare. But, I'm aware of it. When we go to medical school, we learn how to treat these kinds of things. And so I got some experience with it. But I just simply want to mention it. So those are important in the bigger picture of anemia.
Wonderful. Well, thank you again for everything.
Okay, it's a pleasure. Glad to do it.
Thanks for tuning in to another episode of Sensible Health Solutions. We hope you found today's discussion enlightening and packed with practical tips to enhance your wellness journey. Remember, small changes can lead to big results. If you enjoyed the episode, don't forget to subscribe and leave us a review on your favorite podcast platform. Your feedback helps us bring you the best content possible. Stay connected with us on social media for more health insights and updates. You can find us at Sensible Health Solutions across all social platforms. Until next time, stay sensible and stay healthy. This content is for informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Seek medical advice from a healthcare professional for any medical conditions.